Hello, Abundant Grace family. I hope everybody is doing well tonight. So, we all know this is the year of renewal, and I'm here tonight sitting in for Pastor Hunt. So, don't click off, keep watching. So, we'll be focusing tonight on our health and wellness again. And just so excited that you guys have joined us. We're waiting on some more people to come in. I hope everybody has had a wonderful day. We're still holding on to this snow, I see. Kids still having another day off. Yay. Hello, Tiffany Star. How are you doing tonight? Just want to see a couple other people. Hello, Sister Monica. How are you? So glad you guys are safe and warm. Thought this snow and stuff would be gone by now. Hey, Angel. Hope everybody's ready to discuss some numbers and some lab values tonight. Hey, Brother Mario, how are you doing? Hello, Sister Linda. Hello, Sister Gwen. How are you? So excited to see everybody. Hello, gorgeous lady. Hey, Sister Carolyn. Hello. Ed Larthel, I believe. If I mispronounced it, forgive me. Well, once again, just happy to see everybody tonight. So I think we'll have Sister AJ come in and give us a word of prayer before we get started.
Amen. Amen. We just really thank God for this opportunity. And so we just want to open up in a word of prayer. Father God, we thank you for just first of all for our set man who had the mind to bring these opportunities and this information before us as we are in a year of renewal that is a transformed mind for transformed lives. So this month, as we're dedicating it to health and wellness, God, we thank you that we have people in the house, Father, that can bring us divine information that is going to help us prosper even as our soul prospers. So we thank you for that. We thank you for the conversation that we're going to have tonight. We thank you for a safe space, God. We thank you that we will listen intently. We will hear the information and we will take it into our heart and we will use it, Father, for your glory, that as we build our bodies stronger and for the purpose that you have for our lives. Father, we thank you that we know that seeking health and seeking out medical information is not a sign of weakness, but of stewardship. God, it is not an attack on our salvation, but God, it shows wisdom. So guide our thoughts tonight and as we make decisions tonight and today and going forward, that when we come out of this time tonight, we'll have a greater understanding of healing and empowerment. So, God, we thank you for everything that you're getting ready to speak to us tonight, Father God. We ask that the wisdom just flows. And, God, we have our paper, our notes, and we're taking down the information, and this is going to have impact, and it will be a life changing event for us even tonight. And we thank you for everyone that has tuned in and is joining. God, we thank you for the impact, the impact, the impact. Increase is not an option, even in our health. Tonight, we declare that increase is not an option, even when it concerns our health. In Jesus' name, amen.
Thank you, Sister AJ. I appreciate that. Yes, increase in wisdom, God, guiding us. Tonight, we will be speaking about going to the doctor, basically. I think sometimes we disguise fear as faith, and it's okay to go to the doctor. we still believe God can do whatever He wants to do. He's still in control. But it's not a bad thing to go and get a checkup. It's not a bad thing to find out what's going on with our bodies. So tonight, I have a special guest with me. But for those who don't know who I am, my name is Dr. Erica May, and just a little background about myself. I have been a practicing clinical pharmacist for the past 25 years, coming up on 26. I graduated in 2000 from the University of Tennessee College of Pharmacy, and I've practiced as far as retail. I've done clinical pharmacy in the hospital, and right now I work for a large pharmacy benefits manager. Um, Patient counseling basically is what I do all day, drug interactions and things like that. Yes, Dr. Healy, 25 years, 25 good long years. Thank you. Thank you. So I have a little knowledge under my belt, and tonight we're just going to hopefully give you some useful information that you guys can use when you go to the doctor, some questions that you can ask. And basically, when you get those lab values, you know exactly what's going on. It won't be a foreign language to you. So, I'm going to have a little help with that. And I'm just so happy to have nurse practitioner with me tonight. And it's actually my little niece. I can say little niece, but she's good and grown. So tonight I have a nurse practitioner Brittany Richardson Thomas with me.
Hi,
Hello,
I'm so
Brittany.
happy to be with you all tonight.
I'm so glad you're with us. So Brittany is a practicing nurse practitioner here in Memphis, and I thought it would be really good to have her on and join us so that we can go over some of the components of annual physicals, some of the things we can ask our providers about if we're having issues. So I'm gonna turn it over to her just to give you a little background as far as what she's done, where she graduated from, and all of that great stuff.
All righty. So I graduated from the University of Memphis with a Bachelor's of Science in Nursing in 2014. And I worked for about 6 years in hematology, as well as bone marrow transplant, which I absolutely loved. Went on to get my master's as well from Austin P State University. And I've been working as a nurse, family medicine nurse practitioner for the past 6 years. It's been a while. I spent
It's
4 years at Christ Community, and I'm currently at Hollywood Primary Care.
all right, and you still look 12.
Oh, what a compliment.
So tonight we will be talking about annual physicals and checkups. So Brittany's going to take us through some of the things that you can expect, because I think a lot of times people think that they're going to be poked and prodded and all of that stuff, and they have a lot of fear about going to the doctor. So we're just going to go through just a few things to just give you hopefully some useful information. So let's just start out with, why are physicals so important, annual physicals so important?
It's so important because you need to know your baseline and your status regarding your health. And it's important to also be able to update your doctor on your needs and for them to be able to direct you where you should be going as far as, do you need an extra supplement, or if you need help with diet, and just an extra little boost. So I think it's very important to know your numbers, to always share with your doctor what's going on, because it's very easy to ignore. But sometimes that once a year preventative visit can catch a lot.
Exactly. And people should be comfortable with their provider. If they're not comfortable with their provider, find another one. You
Right.
shouldn't be ashamed of anything that's going on with your body. So they've seen it all. You're not the first with that condition. So don't be embarrassed by anything. Just be open and honest, because that's the only way that you can really receive the help that you really, really need. Like you stated, preventative care is so important. So with annual checkups and annual physicals, that's a part of preventing health problems in
Right.
the future. So, what are some of the main components? What should a person expect when they're getting an annual physical just starting out?
So when you're getting your annual physical, you're getting into the room and you might feel like we're asking you a million questions, but those questions are very important, okay? So that'll be the start of the visit. The questions will include your medical history, past and current illnesses, your family medical history as well. So if you have any of that knowledge, that is great information to have, as well as just your social history. Are you smoking? Are you drinking? Or are you working out? Are you having any stress at work? Has anyone passed away in your family? Although that seems like we're prying or you're giving too much information, um, it's never too much. We want to know everything about what's going on. So definitely expect the first few minutes of just talking. And that's, like you said, it's so important to feel comfortable with your provider so you are able to share those things and feel comfortable in that setting.
And I know for myself, when I go to the doctor, I forget everything. So even if I had 15 issues going on, I'll forget 10 of them. So it's really important to jot things down. If you
Right.
have a rash,
Right.
or if you're having toe pain, a lot of times when it remember, to tell the doctor about that. But it's the little things. And they have to see the big picture. So
Right.
um, I know sometimes when you go into the doctor, you get nervous, you get forgetful. So start writing things down like the night before, what I want to, tell him that's going on with me, him or her. So I know you stated you'll go over like a medical history review, past illnesses, surgeries, hospitalizations, all of that type of stuff. Even with your medications, that's another thing that's really, really important. Make sure, if you can't bring all of your medicines with you to the doctor, make sure you're writing everything down, as much detail if you can.
Yes.
If you're on a blood pressure medication, let's just say metoprolol, it comes in an immediate release and extended release. That's important. So whatever's on your bottle, try to write that down as far as the name, so the doctor will have that. That's really pertinent information. Once again, don't be ashamed of your past medical history, different disease states, all of that. Um, like I said, doctors have seen it all, have heard it all. So it's no embarrassment when you go to the doctor. So another part of the annual physical would be what, Brittany, like the vital signs
The
or
vital
vital.
the vital signs. And I want everyone to know when you're sitting in that chair, I want you to feel relaxed, like you're in the most relaxing place, so that we can get some good vitals, okay? Because you do have that anxiety when you're coming into the doctor, maybe waiting a little while, right, in the waiting room. You can get comfortable. Make sure that both of your feet are sitting flat on the ground. You're relaxed. Your arms are relaxed, so we can get the best blood pressure and heart rate for you. Okay.
Great.
They're also going to check your temperature. They're going to check something called your O2 stat. How much oxygen are you getting? They put that on your finger. So just be prepared and be relaxed for that. And if you notice it's a little high, if the assistant maybe forgets to check it twice, just say, hey, can we check that again? Especially if you feel like you were rushed coming to the back. Like, let me get a few minutes. Let's check it again. Because it could just be anxiousness, or just the hustle and bustle of getting to the back.
Because white coat hypertension is real. I've
Yeah.
experienced it before, especially if you're nervous about going to the doctor, like she stated. It may be high that first go round. Once you get in the room, you get checked in and get settled, you've spoken to the doctor, request that the nurse or medical assistant or whoever comes back in to check your blood pressure, right? Because a lot of times, once you've relaxed, that blood pressure will go down. And just in preparation for your annual, what I forgot to ask about would be like to keep yourself hydrated. Do you think that's really important? Make sure you're
Yeah.
hydrated just in case they have to draw blood for labs, which they will do with an annual
Yeah.
physical. It's much easier for them to actually draw the blood when you're hydrated.
Right. Right.
Drawing on a dehydrated person may be a little
It's
difficult.
a task.
And also, you can get into whether they should eat or not before a physical.
Right, right. So I would definitely discuss that with my doctor prior to my annual because it can be provider based on how they handle it. I am really big on that fasted lipid panel. That is when we're checking your cholesterol so we can get the best numbers for this. So you may have to fast prior to your visit, but definitely make sure you talk to your provider. Make sure that's okay for your medical. If you have a medical condition, you may have to take your medicine that morning and eat a snack. So definitely talk to your provider about that. But don't be surprised if they do ask you to come fasting.
Good information. So we'll move on to the actual physical exam. So, what are you looking for? What should they expect?
Okay, so we'll start with our ladies first. Ladies, be prepared. We may have to get completely undressed for this exam. We'll be checking heart, lungs, your abdomen, your breast, and there may even be a time when we have to check your cervix. So you will be undressed from head to toe. At this point of the visit, I do encourage you if there's anything on your body that you're concerned about, point it out to them. Um, like Dr. May shared with us earlier, you have to feel comfortable with your provider because that's how things are checked. If you notice a lump in your breast or anything concerning, point it out in that visit. Say, hey, I would like you to take a second look at this. Don't just glaze over it. Please look at this for me. So for the ladies, I do encourage you to make sure you let your provider know anything that you want to get a second look at, just in case if they're doing it, they missed it. You're in control of your body, and I really encourage you to speak up because things can be missed. So be prepared to be undressed. And for our male patients, I also encourage you to make sure you get undressed, get comfortable. We're gonna check your heart, lungs, abdomen, as well as there can be a testicular exam as well. And if you noticed anything, please point it out. Nothing should be shameful with your provider. You should feel comfortable going over these things, okay? Also, it is head to toe. So you may have to take off your socks and your shoes and get, we call it a microfilament test where we're checking your sensation. We might use a Doppler, checking that blood flow in your feet. So there will be a deep exam going on as far as your upper areas, your eyes, your ears, your nose, and your mouth. We check those too, and we will be feeling around your neck to check for your thyroid gland, as well as for any lymph nodes that may be enlarged. So don't think we're poking and prodding you, but we are checking for any abnormality. And I want to say again, if you've noticed anything, please point it out as well. Okay.
And since we're talking about physical examination, I guess we can just go ahead and start talking about screenings. I know you made mention for women that they may have to basically have breast exam, um, things like that. So, would be if you're going in for a well woman's check, annual physical, um, some of the things that may occur as far as with the testing and screening would be the pap smear.
Right.
So when I know things, the guidelines have changed. It used to be you would go in for a yearly pap smear. Can you discuss like how they've changed that now to where?
Yes. So now we do not have to do a pap smear every year unless you have had an abnormal pap smear the year prior. So we may do it every 3 to 5 years. But typically, most providers I work with, we do it every 3 years. For women 21 to 29, it's just your typical pap smear, and 30 and up, we do add that HPV component to your pap smear. So it is very important to make sure you are going to get those done because it's able to prevent cervical cancer. So it's not to check for anything but cervical cancer for the most part.
Okay. And I know for me personally, like if you had any type of issues in the past, any type of cervical issues, or where they found abnormal cells, even if your provider says, you know what, we can do it every 3 years, you can still request for every year to get a pap smear.
Yes.
So I don't feel
So
like it's just
yeah, so and then I want to bring this up too. Insurance companies still pay for it every year. So if that's what you want, then once again, it's all about that provider. Feel comfortable saying no. I would feel better if I got this every year. Now it won't be earlier than a year. It'll be 12 months. But it is important if that's what you feel comfortable with. You have cervical cancer in your family, you've had abnormal pap smears in the past, definitely request it.
okay. And I see where Sister Kathy Shields is saying, is this the same for mammogram? And I'm taking it if she's speaking on the guidelines as far as every 3 years for a mammogram. Can you speak on that
No,
also?
so we need a mammogram every year. So that's an annual screening that's important. And I do want to also point out to you, this is just a note to know for yourself if you switch providers. If you've had a previous mammogram that was abnormal, say the year prior, you need a diagnostic mammogram the following year. So make sure you let your provider know, hey, let's just say I was at a Medplex center last year. They said I had an abnormal mammogram, and that will let your provider know, hey, I shouldn't order a screening. I should order a diagnostic mammogram. But that is annually, every single year.
And just to note, if you do go and get your mammogram and your doctor has just ordered a regular screening for you, and you tell them that, oh, I've been having some breast pain or I've been having, they won't do the mammogram. They will have to wait on your provider to get orders in for a diagnostic. So if you're having issues, it's best to go ahead and tell your doctor and not wait until you get there for your mammogram, because they can say, hey, we need another order for diagnostic versus screening. Screening is just your yearly mammogram, no issues. But if you've had like nurse practitioner Brittany stated, if you've had an abnormal mammogram in the past, it's best to go ahead and get a diagnostic, which sometimes may include an ultrasound. It's more extensive. So,
Right.
um, and I know you stated with the annual exam, you're going to give them a clinical breast exam anyway, just a physical breast exam,
Right.
feeling for lumps and
Right.
any type of
Every
abnormality.
physical exam, especially a well woman exam, should come with a breast exam. So be prepared and even ask for that because You want to have all the screenings that you need.
And also, all the ladies that are on, try to do your monthly breast exams yourself. When you're in the shower, just feel around your breast and then up under your arm so you can see if you feel any lumps or anything like that. That's your first line of basically defense is figuring out if something is going on, because there's a whole year between mammograms and
Right.
anything can happen in between that year. So it's just good for you to know your own body. So if you know something is going on, if you know something is irregular, that it wasn't there last month, at least you can get on top of it early. So another part of the annual exam, I know that well, we can go ahead and stay on the women's screening guidelines. We'll go on the
Okay.
preventative. So, besides the pap smear and the mammogram, also colonoscopies.
Right.
When should people start to get colonoscopies?
So we should start getting colonoscopies at the age of 45. So
And
that
that's
is,
a change.
yeah, that's a change. And it's pretty much universal now. So colonoscopy, the procedure would be considered your gold standard, something that you want to do every 10 years if you've had a normal one. And then there's another great opportunity. Erica knows how I feel about this. Is for the Cologuard. So Cologuard is a at-home testing that tests for abnormalities in your stool. You can do the test up to every 3 years to help kind of screen for colon cancer. Now, what I like about it is even if you have an abnormal Cologuard testing, you're able to use your insurance to get a colonoscopy and it will be paid for. So it's not like you're getting an extra charge. It's just helpful in keeping you from the anesthesia. Say that you can't get anesthesia, you have a heart condition, or you don't have the time to get the colonoscopy, which is, like I said, is gold standard. You do have the opportunity to get the Cologuard sent to your home.
Okay. And that's basically just a fecal sample that's taken and then sent off to the lab, basically.
Right, right.
All
And they send the kit to your home, and then you sit the kit outside of your home. They come pick it up, and results are usually in within a week and a half.
Great. So I see a question from Brother Mario. He said men don't like to go to the doctor. What are some progressive ways to encourage them that work? Go to the doctor.
Go to the doctor. Go to the doctor. But mostly, this is my big thing. You want to live a long life, but you want to live a long, healthy life. And preventative
Quality.
screening is how you get there. Catching things early. We're gonna get into labs in a little bit as well. There are some labs that are kind of like warning signs, like, hey, you need to make some changes. So it is important to just go. I know that it can be scary, especially when we're younger. We're like, I don't need to go to the doctor. I'm not sick. But it is a way to live a long but healthy life. So I would encourage them to do that. So you want to be around for your family and friends.
Exactly. You want to have a good quality life. It's okay, to have a long life, but you don't want sickly years. I want to be healthy
Right.
and vibrant and enjoying it. So, and that's a way of just staying on top of your health. So let's see. We talked about colonoscopy, mammogram. We did forget. Did we say what age to start with the
So
mammogram?
mammograms start at 40 years old, unless there is a family history. If there is abnormalities, please make sure you tell your doctor, I would like a mammogram.
Okay. And before we move on to labs, let's just talk about some of the screenings, preventative screenings for men, since Brother Mario brought that up. I know you stated they will have a testicular exam during the annual. And I think one of the things that men are afraid of is when it comes down to the prostate exam, which
So
is
is no longer a rectal exam anymore. So we now check the prostate antigen hormone. It's called the PSA through the blood at this time. So don't be scared. We'll just do a blood draw.
and I think that's the main thing for men. They are so afraid of that. And it's okay. It's okay. Like she stated, now basically they do the PSA. Um, and if they have to do a rectal exam, normally that's if something is really going on.
Correct. Correct.
So, okay.
You'll be
And
seeing you'll be seeing your specialist.
yes, the urologist, you'll go in for that. Brother Mario said because we be worried.
Things have changed. Things
Right. It's okay, Brother Mario. It's okay. And for all the brothers out there, it is okay. And when you think about things like that, it's only gonna last for a few seconds. You know,
Mhm.
even for the women with the pap smears, it's only gonna last for a few seconds. So it may be some discomfort, but 9 times out of 10, if you're with a good provider, it's really a very easy exam. So with the colonoscopy, same thing for men, still age 45, Brittany, every 10
45.
years.
Yes, every 10 years with men too. We didn't discuss the bone density scan, which I think it's overlooked a lot, but that's an important screening. Um, and it's called, you might hear DEXA scan. And so that does start typically, I would say 50, but some providers can push it off to 65 for women and 70 for men. But I would ask for my bone density scan, okay? Because
I'll
that's
add to
to know
mine this year.
your bones, and what you need to do. Should you be lifting a little heavier? I know some women, we don't lift heavy, we don't think about that, strengthening our bones, but that could be an indicator of something may be going wrong, or the fragility of your, of your bones.
And just like you just stated, even strength training as we age. A lot of people think when you get older, you don't need to lift weights, you don't need to do certain things like that. But that's really important because it does strengthen
Correct.
the bones. So, and that goes along with our being active. It
Mm.
goes hand in hand with health. We have to start moving our bodies in order for us to stay within that healthy range. You want to get everything moving and going with your lymphatic system, all of those
Right.
good things. And I would
Right.
love for you to come back and we discuss some of that also later. But let's see, we got another question. Is there an age women can stop taking mammograms, say 70 and older?
So, have you had an abnormal mammogram? I would continue getting them. Now at about 75, they do say you don't need it. But I would keep getting it if my insurance will allow me, and I've had abnormal mammograms.
Okay, good
And with the
question.
pap smear, they may stop it after 65. But if you've had some abnormal pap smears, family history of cervical cancer, I would stay on top of my pap smear as well.
Good job. And before we move on to labs, I did want to speak on well child checkups or adolescent checkups. I know that you do have background with working for, was it the school system or Christ Community?
Yeah, with Christ Community, I was one of the providers that was inside of the schools. I was at Westwood, Sheffield, and East High School, all of those high schools, and I did well child all day. And not just on the high schoolers, but 6 months to 21 years old we serve. So it's
Oh,
important to get those wheel trials done. Um, the babies go a lot more frequently than our bigger kids. But I do want to highlight our bigger kids right now, because I see that everybody brings the babies in, but we kind of slow down when we get to our bigger kids. But they also need to come every single year to get their preventative screenings. So they may have to get some blood work done, update on their immunizations, and a full head to toe as well, where they're undressed. We get to look at them from head to toe. We get to ask them some questions. We didn't highlight this with the adults, but it's the same with the kids. But you might be asked some mental health questions just about depression and anxiety. So be prepared to answer those questions, and please answer them truthfully so you can get the help you may need, or um, some counseling from your provider that may be helpful for you. On to the kids, real quick. There may be some questionnaires discussing behavior, developmental milestones. So it's very important to take our babies as well as our bigger kids to the doctor every year and for their sick visits.
and I know we were discussing this a little earlier in regards to your well child checkups. A lot of people, as far as hearing tests and eye exams, how important are they, especially when we start school age children? It could be a problem that you may not know about with just.
Right. So I believe in hearing exams at every visit, as well as a vision screening at every visit. Be prepared that if there's any abnormality, you may get a referral to a hearing doctor, or to an optometrist, which is the eye doctor. But those are very important. So that's even more of a reason to take your babies to get them seen. And once again, that includes our big kids, 11 and up too. I feel like that's a fall
Exactly.
off age between 11 and 17. I don't, after those seventh grade shots, I don't see people.
And it's important because that
Yeah.
your child could be having vision issues, and then you wonder why their grades are slipping, or either hearing issues, a lot of times for our younger children, and that could affect speech, all of these things. So it's best to stay on top of things with your kids. And I know you talked about vaccinations, for especially with the time that we're in right now, with a lot of the insurance companies, the premiums going up, and a lot of people being dropped from insurance.
Mhm.
People don't think they're able to get their children vaccinated. So I know there are programs out there. Can you kind of like tell us about
Yes.
some of the
So the
programs?
state of Tennessee has a program. It's the Tennessee Vaccination Program. It is ran by, a few clinics run this program. So I know Christ Community, Regional One Satellite Clinics, the health department. With what this program allows is for us to give children, uh, I would say zero, so like a few months old, all the way to 18, free vaccinations. So you would be a patient that has TennCare, uninsured, or Native American. You all would fall underneath that program. And like I said, it does allow you to get free vaccinations. So you don't get a charge at the door. You just let them know, I need my child's immunizations updated.
Okay, great. So let's move on to the labs, knowing our numbers. So we're gonna go through those labs.
Okay.
Quickly. Um, and I guess we'll just start out with systems. So, as far as kidneys, what are some of those lab values that you need to request from your doctor, which it should come with your annual physical anyway, but just to make sure that you're getting those, what are some of the big ones that we're looking at?
So, as far as kidney function, we're looking at something called a complete metabolic panel. So the great thing about the complete metabolic panel, it covers not only our kidney but our liver as well. But we'll talk about the kidney right now. So there are three biggies that I like to look at is the creatinine clearance. It measures how the kidneys are filtering waste products from the muscle, which is the creatinine in our blood. And then there is the blood urea nitrogen or bun, and it measures how the kidney is removing liver waste products. So that's the urea in bun, right? Alrighty. And then lastly, the first thing I look at when I'm reviewing my lab is the glomerular filtration rate. So it tells me how well your kidneys are filtering the blood. How well is it functioning? Okay. So those are three big ones that I know that your doctor should be ordering. Now, if they're not ordering a complete metabolic panel, don't fret because they may be ordering a basic metabolic panel. Now, the basic metabolic panel is going to have those three things in it because it's telling us about kidney function.
And just how your body is getting rid of that waste. Okay.
Right, right.
So I know you stated liver. So what are some of the big ones that we're looking for with liver?
So, I look at liver enzymes. We're looking at liver enzymes. So liver enzymes will be ALT, AST, and an ALP. Don't make me tell you what all of those acronyms stand for, but they do indicate
They're
liver
amino
injury.
transferase,
I
something
will
like
watch
that.
it.
It's a mouthful, guys. We're just gonna say ALT, AST. You'll see them on here.
You'll see it. You'll see it on your paperwork. But these are important. These are important to check. It tells us about liver injury, cirrhosis, and hepatitis. And then there's your albumin. It tells us about protein produced by the liver. Then there's your bilirubin and that is the breakdown of red blood cells. And these diagnosis it can pick up is jaundice, hepatitis, hemolytic anemia. So those are some biggies that your doctor will be looking at. Typically, we ordered a complete metabolic panel so we can get all of these factors.
Okay. And let's see what else would be included. I guess since we're talking about the comprehensive metabolic panel, I know electrolytes are included in that.
Right,
So,
right. So the electrolytes we're looking at, and just a tidbit about electrolytes. I'm sure everyone knows when some electrolytes are off, you feel off, right? So some biggies to look at your sodium can make you feel lethargic if it's low. So that's something to know about your potassium. It can make you feel bad as well. So you want to know your numbers with it. Calcium is important as well. They're gonna look at your magnesium, carbon dioxide, chloride, zinc, and alkaline phos, like we talked about earlier. So those are gonna be some big ones that's gonna be looked at. So if you're feeling like you're getting poor sleep, you're feeling jittery, numbness, tingling anywhere, please bring that up to your provider because it could be a medication you're on is affecting your electrolyte, you know. And if your numbers are lower, let's just talk lower right now. Sometimes you don't need a supplement. You can consume it with the foods you eat. I know we discussed that earlier. If you want to elaborate.
and yeah, so this is my judge. So a lot of times people complain about I don't want to take another pill. I don't want, and I understand that definitely the best way to basically treat your body, especially if it's not a critical disease state or issue that you're having. Let's just say if your magnesium is off, there's certain foods that you can eat that will boost your magnesium, like dark leafy vegetables, pumpkin seeds, dark chocolate, avocados, um, all of these things. I rather eat my source instead of take a pill. So if you have a lot of times, if you have a balanced diet, you won't run into a lot of issues, a lot of electrolyte issues, mineral issues, and things like that. So it really is good to eat your veggies and eat your fruit. Stay away from a lot of processed foods because a lot of processed foods will deplete your electrolytes. You
Right.
know, a lot of those trans fats and saturated fats and all of these other things that they're putting into our foods now that we can't even pronounce. And just touching on some of the stuff that Brittany discussed as far as them checking your calcium and things like that. So, with low calcium, we all know dairy products, but there are other things if you can't tolerate dairy that will boost your calcium, like canned salmon, beans, rhubarb. I don't know how many people eat that, but
I'm like,
almonds, those kind of things. Some people do though. Um, yes, Dr. Healy, food is medicine, and that's what we have to start really reprogramming ourselves instead of taking a pill for something. If it's something that you can eat or something that you can do, help yourself that way, because really I rather you have a well balanced meal than have to come see a pharmacist and take 5 to 10 tablets for something.
right. Right.
Um, if you're low on zinc, shellfish, salmon again, lean red meats, pumpkin seeds, nuts, eggs, all of these types of things. So like I stated, food is your medicine. Good quality food is your medicine. And I know you stated the alkaline phosph. Some people may not really be aware of that. But what is that also testing when you were talking
Tell
about
us
some of the
You can
electrolytes?
tell us about is if you have a fracture, how will are it'll show that you're healing. It can be an indicator. Is there something going on with your bones? Could there be bone cancer going on? So I think that's important. And that's why the complete metabolic panel is so useful because I've used it before to figure out what's going on with somebody's parathyroid hormone, So it is important to get these labs done because, like I said before, these could be screenings to help you out later so you can live that long, healthy life.
Good deal. And I know you talked about the lipid panel earlier, and we have another question. Okay. So, Sister Kathy, what we didn't have our PowerPoint today, but I will be handing out a card with some of the top, like the comprehensive metabolic panel, what most doctors are testing for, and that'll be listed. And I also try to get a list of these onto DwayneHunt.org, the pastor's website. I'll try to get that for you within towards the before the close of the week, so you guys can have all of this because I know it's a lot of information with us just talking. It would have been nice to have some slides, but I apologize. It's been a busy week. I apologize. But I definitely will try to get that out to the congregation by either this Sunday or next Sunday because I really want you guys to have those so that you can take it to the doctor with you. At least and then with that, you'll know exactly what we're talking about, like the abbreviations for calcium or Mg for magnesium, things like that. So with the lipid panel, what are some of the things that we're looking at with the lipid panel?
Okay, so the lipid panel, it is everyone calls it my cholesterol blood draw, right? But there's more than just a cholesterol in your lipid panel. There's what we call good cholesterol, which is your HDL, and the HDL we call it good cholesterol. And the reason we call it that is because it carries cholesterol back to the liver to be removed from your body. whereas the LDL, which is considered the bad cholesterol, it leads to like fatty plaque in our arteries, and this increases your risk of heart disease, stroke, heart attack. So that's important for your provider to get these numbers. And then lastly is your triglyceride. Okay, the triglyceride is a type of fat in your blood used for energy. When the levels are increased with this as well, it increases your risk of heart attack and stroke. So it's important that we try to get these fasting, like I said, at least like 4 to 8 hours of fasting prior to getting those labs drawn. But this is provider specific. I was just trying for it to be fasting. But there have been studies shown that it doesn't make a big difference. So have that discussion with your provider prior to your visit. If you can.
And once again, with your lipid panel, with the triglycerides, the LDL or low density lipoprotein, or the cholesterol, all of those things can be elevated. Sometimes it's genetic, and as you get
Mhm.
older, but sometimes it's food, what we're eating. Once again, if we could kind of stay away from those trans fats and those saturated fats, like the chips and the fries and all of your fried foods,
And,
your fried
and a
chicken.
lot of fast food, unfortunately. I'm guilty of Chick-fil-A. Um, but those things are not good for our cholesterol. So
It's not.
home is
And it's
key.
everything. What were you saying, Brittany?
I said eating at home is really key because you know what's in the food.
You do, you do. And it's everything in moderation. Chick-fil-A, every now and then it's okay. Like I
Right.
have a deal with my son. You can eat out once or twice a week. That's it. We have to eat at home the rest of the days. Um, so I know time is flying by. So I did want to make mention of some of the testing. I know you've talked about the bone density, and a couple of the tests that I think are really important, vitamin D, which sometimes the insurance will not pay for, but I feel like it's a really important test because vitamin D basically is linked to everything from our immune system to our nervous system. It's
Right.
important.
It's
And a
important.
lot of Black people, vitamin D is very, very low because of the melanin in our skin.
Right.
And how can we boost it, basically? We need to go outside and get some sun, y'all. It's okay to
Right.
get some sun, and that's your best source of vitamin D. And I know it's winter time, so sometimes that can be a little harder. But in this case, you can take a supplement. Normally, it's recommended around 600 international units per day or a little higher. If you're deficient in vitamin D, then most definitely you'll probably have to take a higher dose. But the only way you're going to know that is if you get lab tested, if you get drawn
Right.
for the vitamin D. But sometimes you can tell that you're deficient in it with brittle hair or hair loss. You start noticing your nails are splitting or breaking easily. So you can be fatigued. It's just a lot of things. So if you start seeing that tingling in the hands and the feet, sometimes it can be vitamin D and sometimes it can be vitamin B. But you won't know unless you go to the doctor and get your annual checkups and your blood draws. Another thing that I wanted to make mention also, just as miscellaneous testing, would be sickle cell trait. And we know that that's prevalent. 1 in 13 Black Americans are carriers. So if you've never been tested for sickle cell trait and you still are in the childbearing years, I would say, do that, especially if you and your partner have never been tested. Because if both of you have the trait, there's a possibility that your child could have sickle cell. So I think that's really important also.
And let's
Um,
let's talk about our honorable mention in is the hemoglobin A1C, right?
We didn't talk about
We
that. I
didn't talk about that.
forgot. That's the
That
main
is
thing.
that's amazing.
That's the main thing.
hemoglobin A1C is a great screening for diabetes. Okay. I encourage everyone at least once a year get that test done. It's a snapshot shot of what your blood sugar has been doing for between 6 to 12 weeks. So it's not about that blood sugar you get in the office. It's not about your fasting blood sugar. You can't hide from this. This is telling
Can't
you
trick
what
the doctor.
you can't. You are gonna be found out. I'm just joking,
You are though.
but it's important to know this number, right? Because this is one of those warning sign labs where if tested and we can find out early, it can let you know if you have prediabetes. And what a great way to get a warning to say, hey, I need to make some lifestyle modifications. I need to make some changes, right? To like my lifestyle, like the way I'm eating. Because it could be as simple as I'm drinking a Coke every single day. That's just sending you over. Just making those changes. So I don't want to holler out lab like numbers. We're not doing that, right? But it is important if they call you and say your labs are stable, right? Some people do that. Say, no, can we review what what are my numbers? Because especially with the hemoglobin A1C, pre-diabetes, we would say is between 5.7 and 6.4. So anything over 6.4, we would say, hi, we're diagnosing you with diabetes, right? Um, so it's important to make sure that they're reviewing those labs with you and that you get a good understanding of where you are. So I just wanted to make sure that was known.
I can't believe we almost missed that, Brittany. Also, the thyroid. Thyroid testing also is important.
Right.
Kind of goes hand in hand with the vitamin D and all of that great stuff. Make sure we're getting our thyroids tested. Because it can explain a lot of fatigue.
Anxiousness, tremors, if you're cold and hot intolerant, brittle nails with this as well. So making sure
Hair
you
loss.
your thyroid disorder screening. And then I know I'm telling all thank you. I'm giving so much info. I'm happy that Erica is going to give you out this card with all of the information, so you can take it with you when you're discussing things with your doctor, as well as when you're getting your labs reviewed. To just say, hey, okay, so where are we at here? It might seem like you're bothering them, but you're not. You're just empowering yourself. So always know your numbers and where you are. Ooh,
Ernest, leave those cokes alone. We're talking about you. No.
go get your A1C.
Checked. Okay. So we're about to wrap up. So if you have any questions that you want to ask, please drop them in the chat and producer T will put them on the screen and hopefully we can answer them. You feel like you're back in school, Sister Sherna?
I think we're good instructors, though. Hi, Miss
Jackie and Brittany work together.
Jackie. Great.
So we'll wait a little bit just to see if there are any questions. Thank you guys for staying. I know we're not Apostle Hunt, we're not Pastor, but we tried to do our best. Hope you guys got some useful information and I hope it helps.
Thank you so much.
And if you feel like we need to discuss something else, just please put it in the chat. Let us know. I'm always open to questions about medication or anything like that. If you see me around church, just ask. I don't mind. If I can answer it, I'll answer it. If I don't know, I'll find out.
I'll research it.
I'll research it and get back to you. So I'm taking we didn't have any questions. Thank you, Sister Kathy. Yes, happy anniversary to the pastor and Lady Di. I think this is their 20th. What is a good diet for hiatal hernia?
Okay, really quick. Avoid spicy foods and fatty foods, okay? And definitely hit it hard on baked, boiled, grilled, eating in moderation, just to help with any discomfort. Okay. Did they answer it? No.
Yeah, that was good. That was good. Oh, inflammation markers
We didn't
like
go
said
on that.
rates and not. Yeah, we didn't. We were trying to put
We actually
everything.
had that on our draft.
But we were like, it's gonna be too much. But
Right.
yes, very important for the ESR, like your SID rate, and a lot of your immunoglobulin, like G and E and things like that. That will definitely give the doctor a heads up to see if there's some type of inflammatory process going on behind the scenes. So those are some of the tests that you can ask for: a SED rate, some of your immunoglobulin like the G and E and things like that. Did you
And you
need to
said
add anything,
the
Brittany?
C reactive. You said the SID.
C react. They may sometimes they won't pay for it. How
Right.
can we get them to pay for some of this stuff, Brittany, when they
Right. So this is these inflammatory markers aren't a part of annual wellness visit. It would be under that miscellaneous where we also have that vitamin D. So my thing is, are you having swelling, chronic pain, things like that? Those are indications to order in, inflammatory markers like the C-reactive protein, the SID rate. Um, so if you have that going on, share that with your doctor so it can be covered. Because sometimes the insurance companies, unfortunately, they do not pay for all of the labs that we, even as providers, we think are important to evaluate. We do have to show why a patient may need them, or they'll say, oh, that was unnecessary. We're not going to cover it. And you're stuck with a 200 plus bill for some labs. So, even with your vitamin D, are you fatigued? I'm just joking.
but
But
yeah. So
sometimes
we
that's
have had so much. So I just want to say thank you so much, Brittany. Thank you for doing this favor for your aunt. I appreciate it so.
for
And
Rainy Day.
and hopefully we can have you back for a part two.
Okay.
Um So, abundant grace, it is time to wrap up. But before we wrap up, we know that it is offering time. So, our ways to give are on the screen. So, please, please, please take out the time. If you can't do it now, just make sure you do it after the broadcast to go ahead and give. So important. Give, and it'll be given back to you in some form or fashion. So, once again, thank you, Brittany, and I hope everybody enjoyed this broadcast tonight, this stream tonight. And I just want to remind everybody we're still moving. Get moving. We're still doing our 1 mile a day. We're still staying active for about 30 minutes a day if you can. Just jot those steps down that you're taking, and then I'll have those cards ready for you Sunday so that you can go ahead and keep documenting your steps per day. Um, and I think that's all we have today. So I thank everybody for just staying on. Like I said, I know I'm not Pastor Hunt, but we appreciate you guys interacting and um, giving us some hearts and some likes. so we can get in the algorithm so that the word can still go forth. And I'll just like to bless you tonight before we leave. So may the Lord bless you and keep you. The Lord make his face to shine on you and be gracious to you. The Lord turn his face towards you and give you peace. And may all of his blessings, his name be yours. Thank you guys. Have a great evening.